Roughly once per week, I pay a professional to help me maintain my body's physical health. Sometimes we work on flexibility or stiffness, and sometimes we might work on a painful muscle, backache, sore wrists, or a kink in my neck. I call it preventative maintenance for my body. Though I'm young, in the past, I have suffered from severe chronic back pain, just like many dentists, and at times it has felt almost debilitating. There were days where I would just sit in my car and hope that some of the back pain would dissipate before I went in to start my day at work. I did end up going to physical therapy, which worked wonders for me, and most of my back pain went away. I don't have the same chronic pain I did before, but I don't ever want to have things get that bad where I have to go through that process, or maybe when I'm older, worse, like surgery. As we often tell our patients, by the time something hurts, it's often too late. Or rather, you've got a much bigger problem on your hands than had you done some preventative maintenance or some preventative care to take care of your body. NBA legend LeBron James famously invests anywhere between $1 million and $2 million every year just to take care of his body. It's beyond what the team may be providing to him. Okay, so I thought to myself, if LeBron James can invest like several $1 million per year to upkeep his body, then I can invest something. So I spend money to take care of my body. Shout out to Reach Bodywork in Ann Arbor. That's the place that I go to. So sure, we as dentists are not NBA players, but much like NBA players, we depend on our bodies for income. Over 70% of dentists report chronic back pain, and dentists are classified as a high risk for both neck and back pain due to the awkward positions that we put ourselves in to work just to get to that right spot, even though we know we're supposed to have our good posture with our loops and the back up straight. In reality, we don't always do that. We also have a really largely sedentary job where we're sitting down in a seated position for hours and hours per day. Thirdly, there are, of course, those times where you have to get up and put your knee on a patient's chest to pull their tooth out. Kidding, not kidding. But maybe more alarming than the back pain even is the massive incidence of carpal tunnel-like nerve damage that is found in dentists compared to the average population. This results in a loss of grip and sensation of numbness in the hands, which of course we need to do our job. The average incidence of carpal tunnel syndrome in the general population floats anywhere between 1% and 2%. But there are some studies that show that dentists, up to 18% of them at some point, will demonstrate some level of nerve damage in the median nerve in the hand and wrist. The median nerve is the nerve that is going to demonstrate damage if you have carpal tunnel syndrome, which again is that numbness or loss of grip strength that you may experience. So the truth of the matter is, if you're in chronic pain as a dentist, you won't be able to perform your best work in terms of quality or volume, which affects both patient care quality and your financial bottom line at the dental practice. So professional athletes invest in personal trainers, chefs, massage therapists, cryotherapy, hyperbaric chambers, dietitians, physiotherapists, and beyond to invest in their bodies. So LeBron, he's been able to play basketball at a peak level nearing age 40 now, whereas most NBA players are already out of the league far younger than that, just because their bodies don't hold up. So LeBron's prime physical years have almost seemed to be endless, and he's got an aversion to injury for the first 2 decades of his basketball career that has seemed almost mythical in professional sports circles. And this longevity and vitality is something that happened with great intention and great planning on LeBron's part. And this longevity has resulted in an ever-increasing legacy, ability to earn, more records broken, and more championships on his resume. So what will you invest in your body? Your body is the engine that makes your dental practice go. I don't think anyone reading this is going to invest $1 million into their body per year. But what could you invest? And what dividends would that return